Welcome everybody, I'm Dr. Jeff Abrams of Abrams Chiropractic and Acupressure here in Greenville, South Carolina. Today I want to illustrate how to do some trigger points on the low back or acupressure points to relieve some of the discomfort that you may be experiencing. As you can see in this chart, you see multiple colors, and those illustrate different patterns and pathways in which we can have trigger points all throughout the body. So today what we're going to be specifically looking for is just in your low back. So I have Exhibit A patient as she is face down. And what we're going to do is get her nice and comfortable laying on her stomach, and we're going to grab some lotion here, and make sure you put the lotions in the hands to warm them up, otherwise you're going to shock your patient out of the system and they won't appreciate that. Alright, so I've got some lotion in the hands. I want to apply that lotion right to the back. I'm going to grab the top of the hips. You'll feel these hip bones, okay? And then you want to take your thumbs and get right close to the spine. From the spine you want to go outward. And then you'll feel that muscle kind of round out and then down, and it kind of drops off. As soon as it drops off, you're going to apply pressure towards the spine and upward towards the head. And you want to take your time with this, and then as you go up towards the head, you're going to experience some knots that you feel, and you'll find some tender areas on your patient that you're working with or your spouse. And when you find that spot, you just bore in, literally 30 seconds to a minute, to release some of those toxins like lactic acid that are building up in the muscle fibers. So you apply that pressure, and as soon as it releases from your thumb, then you just want to continue on up. Now remember, it's kind of like a Christmas tree-like form. You know, when you start down at the base where the pelvis is, it's a little bit wider, and then, like I said, you're going to apply the pressure towards the spine, around the muscle, towards the spine, then all the way up like a Christmas tree as that muscle tapers. The last trigger point, and I know this is a little bit hard to illustrate because she's got the paper towel here, I'm going to go ahead and flip this up, is for your glutes. And what you can do is you take your thumb here and your finger here, grab the top of the pelvis, and grab right down where that bone is. There'll be a little bony prominence, okay? And that's actually called your posterior superior iliac spine. Not to talk over your head, but that's just our landmark we're looking for. It's just that bone that kind of sticks out in your pelvis. You're going to put your hand just like this, lay your hand flat, bisect the two. Bisect where the thumb and the forefinger are right here, and then you're just going to apply pressure. So for those of you who have sciatic pain, this is the key spot. This actually works out your piriformis muscle, which is where the sciatic nerve runs through, and a lot of times that gets really tight and clamped down and built up with a lot of toxins, and this will release those toxins. And once again, you want to hold from 30 seconds to about a minute, okay? Always, always, always drink lots of water to flush those toxins out, and put some ice on if you get sore. If you're interested in getting an acupressure treatment here, we're in Greenville, South Carolina at Abrams Acupressure and Chiropractic, and reminding you all to elevate your game. Thanks for watching, everybody.